Okay, it looks like everybody's here, and if you're able to get the slides up in front of you, that would be great. If you can either get them through the email, or if you're in Zoom, you can go down into the chat box and click on the attachment down there and pull it up. That way you can follow it at your leisure. So welcome to GIF. My name is John Mers. I'm the co-chair, one of three for the balance of state. And for those of slide, we're going to start with a little group activity. So what I want you to do is either do the hands of the boy or the hands of what looks like the mom, and just groan. We'll do some breathing exercises in between, but I think we're all at the point now where we're starting to fray around the. Just want to acknowledge that and appreciate that you guys are doing phenomenal work 24/7, and we honor you, we support you, and we invite you to be kind to yourself and others. So without further ado, let's take a moment of silence. We know that we've lost not only consumers, clients, but also staff and some family members to COVID. So if you'll just join me for a moment in silence. So in their name and in their honor, we'll continue to do the work that we need to do. For those of you who have been on these weekly calls, our agenda remains the same, with some announcements, some updates, and then we spend a half hour on strategy. We're happy to have Michelle Anderson with us today to talk about supporting the educational needs of homeless students. So some very quick announcements. Lana from HUD, if she's able to join us today, will do so when she can, but DOH, Cara Capobianco will cover those pertinent topics that Alana normally would cover with us. We want to welcome Dan Ancomi, am I saying that right, Dan? From DSS. So happy to have him provide some updates. Just, I know that David Gonzalez-Rice will probably mention that there's a webinar on Monday regarding shelters and testing, so he'll give you more information on that. Multiple reminders that next week our meeting is going to be at noontime. So if you show up at 11, we won't be in the room. We've given you an update be on one of the last slides here, but just want to verbally acknowledge that we'll be meeting at noon next week. And then just a final reminder, I know we're completely overwhelmed with a lot of information, but we post our updated responses to our website. You can always email us any questions when we're not together. And also just a reminder that HUD has a daily exchange that's really good. And among the many links at the back of the slideshow is one there directly. So welcome. And without further ado, we'll have Cara give us an update from DOH. Hey, Cara.
Actually, I'll take it.
I'm gonna.
Oh, Steve.
Yay.
Whoa.
I'm here.
We are
I have
honored.
some time today.
So Steve DeLella is one of the three co-chairs representing the Department of Housing. So he's been burning the candle at both ends, and so glad you could join us. What's up?
Sure. A couple items. We've sent out a couple of different issues. One is we sent out something from the Office of Early Childhood that clearly states that they're providing childcare for frontline workers. And in their announcement, that frontline workers did include shelter staff. So if you have any questions, just let us know. OEC looks like they'll be able to provide some level of childcare support for our frontline workers. At News, we all know that childcare has been a struggle during this time, so we're happy about that. Next, we also sent out confirming some of the work that we've done in associates as it relates to RAP. We made these decisions really, really early on in the process, but finally put pen to paper and put that out. So basically, a lot of things were cleared up, specifically around inspections. We have delayed all renewal inspections. We've also allowed for new initial inspections, but as best as we can do it by telework, FaceTime, whatever, just to take a quick look. And then obviously we'll follow up with the real deal once time permits. Also, in terms of we have terminations for 60 days, so we don't have to worry about people having their RAP certificate removed for any reason during this time frame, especially as it relates to non-payment. We certainly also have allowed for a more quick process for changing individuals' income, so that the program can pick up more of the burden if somebody has lost a job. Instead of going through the process, we just take the word of mouth and then we'll verify it after the fact, all in an effort to make sure that folks do not fall behind on rent, so we can keep them going forward in good rental standing to prevent further evictions down the road. DOH also had its virtual public hearing as it relates to the new CTBOS. So for those of you who did not take part, we did have public comment, but that public comment has since closed. It was only needed to be open for 5 days. We did receive some comments. Specifically, our first round of ESG is really going toward a couple of different items. One is rapid rehousing. Another is a prevention program to stop folks from entering into the homeless service system, focused around evictions. Also some funding for shelters, as well as some technology for telehealth or telecommunications, so that case managers can kind of do their job without having to see somebody in person. So hopefully we will submit that to HUD soon. Once we get the funding available, we'll start dispersing it as best as we can. The shelter funding, we've really tried to figure out how best to increase COVID costs. As you know, we've done a major effort to deconcentrate the homeless shelters by putting folks in hotels. So we know that that is most likely to be FEMA reimbursed. So we actually sent out information to the CANs earlier this week, asking them for their costs on a couple different levels. One is on a hotel level, because those costs really appear to be FEMA reimbursable, and those costs that have increased at shelter level, so that we can actually put together some budgets, try to identify what are the true increased costs that our providers have as it relates to COVID. Not just shelters, we've actually asked the CANs to do this overall, so we're collecting information about permanent supportive housing programs, rapid rehousing programs, soup kitchens along that line. So at least we'll have the information. We'll then be able to take that information to determine how best we can reimburse as much as possible based on FEMA rules and or other OPM funded programs, and see what OPM will allow us to have. So that information has been, is due to us today, although some CANs have asked for extensions, but just be known for any CAN that asks for an extension, obviously that will delay, because it certainly was posed to us as being kind of an urgent need, so we want to try to get the funding to you as quickly as possible. So those are the major issues now. If anybody has any questions, please feel free to reach out.
Great, thanks, Steve. And just a reminder for folks, you can use the chat box. It's being monitored, and Housing Innovations, which is the consulting firm that staffs the continuum of care. We've got lots of their staff keeping us, all of these processes going. So want to spend a minute to talk about the CDC recommendations for testing at shelters, and who's going to take that one?
We just put this in for informational purposes. There's a lot about testing at shelters going on. So I know already, I think Hartford just has been doing massive testing. There was an NPR article. And so just wanted to share. There is also a webinar today by the Healthcare for the Homeless on testing for COVID-19 in homeless shelters. And when we hear from CCEH, I think David's going to talk about what they're doing on Monday with the Connecticut Department of Public Health. So really informational slides.
And just a reminder, the links in the slides will take you directly to registration, portals, etc. So in no particular order of favoritism, we'll hear from DMHAS first, Alice, who is also the third co-chair of the Balance of State COC. Good morning, Alice.
Thank you, John. I just have a couple of quick updates related to some of the, as I drop my phone, some of the work related to, deadlines and things. We got an email saying that the pandemic, the data entry for the DMHAS consumer satisfaction surveys are going to be extended through September 30th. So I know, thinking about getting all of this done and put into the systems are not like high on our priorities, but just so everyone knows there is an extension, and I can send Liz the provider alert so that it can be put into the notes, the minutes for today. So there is an extension for that. The other thing I want to let everyone know is that there were some waivers related to some of the documentation and different things like that related to the services end of the work that you guys do. And so we've put some waivers in a document that we're going to send out. They're mostly at this point related to the permanent supportive housing programs. There will be some that are related to the PATH or the homeless outreach programs, but those we are still finalizing. So just to be on some waivers, and we are going to have those be retroactive to the start of the pandemic. I think we put April 1st as the start, but I could be wrong on that. I just can't remember. So those are the DMHAS updates. Obviously, if after reading some of the documents, you guys have questions or concerns, or there are things that you feel are missing, as I said, these are all works in progress. So you can certainly give me a call. Probably easiest to shoot me an email, my cell phone, and so I can respond and put those questions. I'll help with those questions.
Great, thanks, Alice.
Thanks, Joe.
Just a reminder that we tape this every week, and so if any time in the future you're not able to join us, or if you think, hey, I remember they said something, I can't remember what it is, you can always go back and review earlier transcripts of these meetings. So with us from DSS, welcome, Dan.
Thanks you for having me. Good morning, everyone. Thank you for having me. As John said, my name is Dan Giacomi. I'm a program administration manager at DSS in the Division of Eligibility Policy and Program Support. So what I wanted to talk to you a little bit about today is some of the most pertinent work that we've been doing throughout this public health emergency here to support you all, and more especially to support the clients that we have in common. So obviously, there's a short period of time for me to talk, so I'm not going to go over everything that we have, but I would encourage, if you'd like to see all of the topics or information or programs or things of that nature that we do have, if you could visit our website, www.ct.gov/DSS/COVID, COVID. That kind of gives an overview of all of the initiatives that we've undertaken and are currently undertaking social services. But for the purpose of this meeting this morning, as I said, I just want to go over a few of the hottest topics, so to speak. The first is the treatment of the stimulus checks as well as the increased unemployment compensation benefits that went into effect as part of the Corona Relief Act as well as the CARES Act, and how they're effective or what is on our programs. So first, in speaking of the stimulus checks, so the $1,200 that individuals are eligible for, we as an agency and through the executive orders of the governor and our commissioner have been able to get all of those stimulus checks excluded from all of our programs for income. So if an individual is applying or receiving benefits from the Department of Social Services, they do not need to report to us the stimulus checks, and they do not need to worry about that reducing or eligibility from our services. In regards to assets, we have also, for all of our programs, been able to, at least for the extent of the public health emergency, for our cash programs, been able to waive that as a countable asset. But for the rest of our programs, our Medicaid as well as our SNAP programs, we've been able to exclude that for a period of 12 months from the date of receipt. So if there were any funds left over after the 12 months for those programs that do have a test, we would count them. But for the first 12 months from the date the individual receives it, that's going to be excluded. In regards to the unemployment, the additional $600 that individuals are going to be receiving, that is a different set of situations. So for that program, for our Medicaid, so our Husky A, B, C, and D, and our CHIP, that additional $600 will also be excluded from eligibility. So we were informed from our federal partners, ACF and FNS, that we are not able to exclude that income from the SNAP and cash programs. So if an individual were to receive that, that would negatively affect their eligibility, whether it be a reduction in benefits or removal from benefits for that program. So before I go on to that, I just wanted to make sure if anybody had any questions with that, and I want to make sure to mention, you could either ask me here, or if you wanted to reach out by way of Liz, you can do that as well, and I'll be sure to get any answers or follow-up that you require for that. The next thing I wanted to talk about very briefly is something that you may have seen was announced yesterday during the governor and the email that he sends out if you're on the email blast that goes out, and that is that we're preparing to implement new coverage groups for uninsured children and adults in the Husky Health program as part of the response to the COVID-19 public health emergency. So there's two different kind of programs that we just recently announced, and we have not come out with any instructions or guidance pertaining to them. We hope to have that within the next few weeks, middle of May, I believe we're expecting that to come out. So there's two coverage for the uninsured, and then there's emergency Medicaid specifically for non-citizens. So the first, the Medicaid for the uninsured, it's uninsured state residents of any income level may be eligible for free Medicaid coverage of COVID-19 testing and testing-related provider visits. This is a federally funded Medicaid coverage group. It's going to cover both citizens and qualifying non-citizens. So normally those that have already met the 5-year residency bar, and any testing and provider visits that occurred between March 18th at health emergency. So what we'll be asking the Husky Health providers to do is to retain records regarding the testing and testing related visits for that period of time, and then once we give the instructions, to submit them for Medicaid reimbursement. The second, as I said, is the emergency Medicaid for non-citizens. So those would be Connecticut residents who meet the financial eligibility requirements but do not qualify for full Medicaid coverage due to the fact of their immigration status not allowing them to qualify. So this would include undocumented, and all of those individuals would then be able to receive Medicaid to treat an emergency medical condition. COVID-19 testing and testing related provider visits are emergency visits that would be covered under this emergency Medicaid. And just as a reminder for those that may be concerned about it, emergency Medicaid is not a factor in federal immigration public charge determinations. So if they were to receive this assistance, that would not go negatively against them determination. As I said, we expect to get more guidance out on both of those coverage groups within the next few weeks. And then finally, just on the SNAP side of it, there's two initiatives that we're working on, or that we're just, I'll actually say 3 initiatives that we're either working on or just recently announced or have implemented and are extending. The first is the emergency allotments, and that is for SNAP household receiving the maximum benefit for their household size. So for those of you that have knowledge of SNAP households, we'll say for a household of 2, the maximum benefit side for a household of 2 is $355. If a household of 2 is receiving any less than $355, they would receive an emergency allotment of the difference between whatever their benefit amount is and whatever the maximum benefit amount is. So if we're using that same example, if the individual was receiving $55, as I said, the maximum benefit is $355, they would receive an emergency allotment of $100. This program we've already ran twice. The first benefits went out April 8th, and the second set went out April 20th. We're now extending that program into May as well. So we'll run a third set of benefits around, I believe the disbursement date right now is scheduled for May 8th, 2020. So these are in addition to the normal benefits received between the 1st and the 3rd of the month. And at this point, we've already, I think, in federal SNAP dollars have issued approximately $32 million into the state, and we're averaging about $16 million per disbursement. So once we do May, it'll be around $46 million in additional SNAP benefits that we've brought in. The second program for SNAP recipients that was just announced, I believe, a week ago today, is EBT, or PEBT. Pandemic EBT is specifically targeted for households that had children in school that were receiving free or reduced price meals, but that are obviously no longer able to do so because school is not in session. The individual did not need to be, or does not need to be, a recipient of any DSS programs in order to qualify. They simply need to be in school and be receiving free or reduced price meals. So that would include undocumented children and homeless children, CEP or community eligible schools, foster care, so on and so forth. They're automatically eligible, and through our partnership with the State Department of Education, we're identifying all of these households, and we'd be sending out either benefits to their existing card if they're a current recipient of benefits with DSS, or an EBT card to the newly eligible household with guidance about whether or not they want to participate, and if they choose not to, what they can do or how to use the nature. And then the third one, which we are currently working on, have not yet implemented, would be online purchasing for SNAP participants in the state of Connecticut. Currently, some retailers allow SNAP participants to order online for delivery or pickup, but then require them to swipe the card once they get to either the store or the delivery driver gets to their house. What this program would do is for the participating retailer, the individual, or the household to go online, pick out the food that they want to purchase, and then pay for it directly online with their EBT card, which would then allow them to have the delivery come right to their house. So there would be less interaction or direct interaction between them and the delivery driver or the storefront in helping to maintain some of that social distancing that we've been asking to maintain. As I said, we're working on this. We're hoping hoping to have this implemented around the last week of May, first week of June. What we would have to do is it would first go live with our participating retailers, which are in our state is Amazon, Walmart, and select ShopRite stores. And then once we're up and running, we would be able to work with additional retailers to get them to participate as well, to add on and accept new retailers into this program.
Again,
so those are kind of,
that's
yeah.
great. Yeah. You've given us a lot. I think we're going to have you back in a week or two, or maybe every week. I'm going to suggest that we work with you to get a slide or two added to next week's presentation with all of this really good, dense information. So thank you. Moving to David Gonzalez-Rice from CCEH.
Hi, thanks everybody. So I want to really call attention mostly to some things that are in the newsletter that went out today. Let me pull up my notes here and just provide a couple of additional points of context for those things. Links again are in that email. Mentioned before, the webinar we're hosting with DPH on Monday. That's going to be a two-parter with DPH this Monday, and then shortly after that, in the following week, we're working right now to schedule a quick follow-up focused more closely on the ground implementation of DP that'll feature New London Homeless Hospitality, Community Health Center Inc., and some of the other partners from the communities that have, figured more of this out around COVID infectious disease protocols and so on. So be aware that will be a two-parter, but DPH is really helping us think about what all of the components of an effective infectious disease protocol would include. So we hope that even in the communities where something's working pretty well, that there'll be opportunities to shore up, fill in any gaps, and also to answer questions. This is an evolving situation, so what your protocol looks like in week 1 might be different from week 8, 12, and so on. CTBOS shared a memo from CCEH and Linda Casey about data sharing. So again, as part of our partnership with DPH, we're exploring how to share information about persons in our systems of care who are prisoner transmission protocols, recommended isolation, and so on. And short of being able to do that through an administrative data match, we're working with them on a process to put the CANs in touch with local health department leads in the same geography to be able to share that information over the phone. So CCEH's memo about what activities are covered under existing ROIs went out via our newsletter and through CTBOS. Please take about information sharing permissions. Be aware that the HMIS fields and structure to flag and track COVID diagnostic status are getting built out with Nutmeg as we speak. So they're not ready quite yet, but once they are, you'll have this guidance to refer back to. And I'll mention that Kim, whose last name I can never pronounce, Ploshaj, from Department of Public Health, has leads in each of your regions on an introduction to each of the local health department heads who has a jurisdiction that contains a shelter or a hotel functioning as a shelter right now, which adds up to 19 health departments. So know that those relationships are being built to shore up these processes on the ground. I'll mention just 2 more things. CCEH launched our BOS Foundation's rapid exit and diversion strategy earlier this year, and part of that included the Department of Housing putting up some money up front to get us going quickly. That has been opened for rapid exit from shelter for families, as well as diversion for families and individuals. We've been gradually expanding the eligibility for that fund in response to the pandemic. We've decided now, in consultation with DOH, to open up as well to rapid exit for individuals. We know that money have run short around the state. So we have a bit of work to do today and possibly into Monday to get the financial requests structure built out to include that category on our end in HMIS in our Smartsheet portal, and then to execute some new MOUs. So please watch for notices from us about availability of that funding very shortly. Last thing I'll mention is, unsheltered homelessness remains a major concern for all of us. I've been talking with Department of Public Health and other state partners about the most effective ways to promote and message the CDC guidance recommending against clearing of homeless encampments, and some suggestions about what communities, municipalities, and service providers can do to support encampments in place when people who are living there are not going to access available shelter or housing soon, as we know that due to complex interplay of factors that contribute to and will remain outside. So we have opportunities in the wings with Connecticut Conference of Municipalities, Department of Public Health, and the DMHAS regional coordinators to the emergency management departments to promote some of that guidance, just working on the best way to digest the CDC guidance for a Connecticut audience of non-homeless providers, and should be getting that out shortly as well, with some follow-up webinars to encourage planful responses to homeless encampments and really try to prevent any clearing or sweeping events.
Great. Thanks, David. I'm going to move us on Housing Innovations to move us to slide number 20 and introduce Michelle Anderson from Advance. Michelle, if you could just show us what you look like.
Sure. Let me get my, there I go.
There you go. You don't have to stay on. I know that you want to be able to focus on your presentation, but
that's what I was going to do.
Just wanted to give people the opportunity to see your face, and then take from there. And if you don't spend the whole half hour, we'll circle back and do some of the other. Hey, Michelle.
Okay, great. Thank you, everyone, and thanks for having me. And again, I hope my internet connection stays good. That's why sometimes I have the video off too. It does a little bit better, but I'll move to my first slide here, and I thank Suzanne for helping me with that. Great, perfect. So Michelle Anderson, I am the McKinney Vento Liaison primarily for Torrington Public Schools, but I also help the whole Northwest corner. So I partner a lot with the CAN in my area. And I'll switch to thank you. Great. So McKinney Vento Liaisons are in every single school district in the whole United States. And our job is to work with families experiencing homelessness in schools. So every school system in our state has a McKinney Vento Liaison. I'm not going to go over this definition of what we deem homeless for children because it's lengthy, but I want to draw your attention to the fact that it's not the same definition we'll all use when you're working with families or individual homeless individuals that you may serve. It's a little different. So the DOH definition is different. Okay, I'll switch to the next slide. Okay, great. Just some statistics to give you a little perspective. We have a lot of homeless kids in our nation, and our schools really provide the stability that these students need, and early care programs are really happy that OEC does take the Office of Early Childhood in our state. It was mentioned before, we really do take homelessness serious in our state when it comes to all children, birth through school. So when schools are closed, we have trouble tracking kids because we work with kids when they're in school. So, so when they move to online learning like we are right now, we're having trouble connecting, and we're wondering about their health and safety. I'll have you switch the slide. Thank you. So McKinney Vento liaisons are still working, just as teachers are still working and school social workers are still working. We're just working a little bit different, but there has been a lot of guidance out there from our federal Department of Education saying McKinney Vento liaisons don't go anywhere. You're needed right now. We are looking for. We're still doing the main tenets of the law: identification, outreach, enrollment, coordinated support for children experience. These are some things that liaisons are doing right now out in the community. They are really helping connect families to resources, looking at seeing what the needs are with distance learning, helping families access distance learning. What I am doing particularly is I am working with folks right within my CAN. So I can't thank you all enough, because you right now, all of you on this call, are really helping us do our job, because you're still interacting with the families. We're being told to learn and social distance, and I know you're all doing that too, but you have the connections right now that we need. So I'm working a lot with the folks in my CAN to find these families and connect them to what they need. So you can just see some things that we're doing. I'll switch to the next slide. And on the slide before that one, there was a list of all the McKinney Vento.
Oh, sorry.
Oh, okay. There is a list. No, that's okay. There's a list. There's a live link to all the McKinney Vento liaisons in our state. So if you're in a CAN in the Meriden area, you could go on and you could see who's Meriden Schools McKinney Vento liaison. School districts have special grants too that allow some resources towards McKinney Vento outreach. Torrington Schools is one of them. That's why they have a person like me that dedicates some time to this. And we've been able to provide families with food cards and gas cards. And so sometimes we can be really helpful to the CANs, because we can help you, you know, figure out how to get a family different places. So we can go forth with that. Yep. Okay, you can just look at that. Just like you're having too, we're losing track of families. The McKinney Vento law allows families who live out of district to attend the school where they became homeless. So those families right now are even harder, because they're in different towns than where the school is located. So, you know, they were getting bus transportation back and forth to school, but now that's been a little more difficult. So we're losing track of some families that way. You know, we're losing safety net at school. That's where their meals are provided, transportation, support. So we are trying to really make sure those needs are met. A lot of districts are offering free meals. So part of what I've been doing is just really connecting families to all those resources. You could go ahead and switch slides here. So strategies we're using right now to assist families, we're still working on identification. 2 new families have popped up in my area that were not on my regular list, but they're popping up because they're all the factors of being homelessness are really upon a lot of families right now. So we're actually seeing an increase in homeless families. Basic needs, we're trying to really connect them to any resource, mental health support, and access to learning. And I know that's what we're going to talk a little bit more about now. We can move that slide. Yeah. So what have we been doing, McKinney Vento liaisons, to get families to distance learn? So I'm a mom of 2 kids, and my kids are distance learning, and I'm very busy, and it's been stressful for me. So let's try to layer that with a family that's homeless, a family that lost their job, a family that doesn't have enough food. You can only imagine the stressors of that on top of a family. Now they have to homeschool and be their child's first teacher. So, you know, we're providing mobile hotspots and laptops to shelters, motels, directly to families and youth that we know homeless students are staying with. My area, I've made a couple deliveries to all those places. And you know, I just want everyone to know the school systems are being super flexible with attendance. They're not really taking attendance, but they're trying to encourage student engagement. So I think all of you, it's important for you to know that you know, we're not asking parents to produce little Einsteins right now. We just want the students to be engaged as much as they can be. And you know, parents do a great job helping their child. They just have to be reminded that parents are their child's first and best teacher. And right now, all of you could really work to promote that, because we need parents more than ever. And we know this isn't a perfect situation. There's so many stressors, but if parents are just reminded that, you know, just have your child engage with the school right now. They don't have to be on a computer for 20 hours a day. Just that simple engagement, the encouragement and motivation is done. Okay, I'll switch there. And you know, districts with special education, some of our homeless students are special education. Districts are really struggling with this because they tried to get the regular ed kids up and going, and now they're really looking at the layer of kids with special education. And this is a huge stressor for parents that have kids with special needs, because they need more than just that coaching to get on and participate in class. So districts right now rolling this out, they're doing a great job under these circumstances. So everything involving with special education right now, districts can do. They can hold PPT meetings, planning and placement team meetings. They can offer individual instruction for students. And they can conduct reviews and reevaluations, do evaluations. So parents just need to be reminded, if your child is special needs, the help is still there. We can get them the help that they need. It's going to look a little different, but parents should feel empowered out to their school if they're struggling, or their McKinney Vento Liaison if they have a student experiencing homelessness. But right now, the families are the coaches and mentors for their children. So this is very difficult if your child has special needs. Okay, these are great resources on the Department of Ed website, all around homeless education, and then around special education and social emotional support. They're live links. I'd encourage all of you to look at for families. We really want to empower families. They're our first line of support right now, and that's who you're seeing. You're seeing some of these families. Okay, we'll do next. All right, and this was a slide that Liz had shared with me, but I have learned about this program. It's a state resource for when parents are stressed, and what do you do? Talk it out line. And it's definitely something the OEC is collaborating with, and you want parents to know that we recognize that it's a very stressful time for them. So please reach out, because we understand this. And I actually connect with all the school social workers in the Northwest corner, because that's where I do my work. And we have been meeting weekly on Zoom. We have a meeting this afternoon, because we are just trying to support each other through this, because they're losing track of kids, not just homeless kids. So, you know, if it was a child that was already hard to pin down and to reach out to, this situation we're in just added to that. And I'll just, from my experience, I've been calling a lot of our homeless families. Some of them are doing quite well because they are still working. A lot of grocery store workers, gas station workers. So they are still working, but you know, they are very stressed because they're working and their children are home, not getting their support. So it's such a varied situation right now in terms of how everyone is just kind of surviving, but can't thank enough all of you that are dealing with the day-to-day, the boots on the ground, working with the shelters to really make sure people are safe. It's been an amazing feat. And I'm very fortunate in our area that I do work really closely with CAN members, because we can get a lot done that way. I couldn't do this without you guys, especially right now. And that's why I encourage you to go back to that list of McKinney Vento liaisons and reach out, because they know the families that you are seeing through your doors to place for housing. It's just, you have to remember the definition on the education side is much broader than the definition that qualifies you for housing.
Michelle, thanks so much. I know we've got a couple more slides
Yep, that's
with
it.
some resources as well
National,
as
yep,
Michelle's contact information.
yep.
We always try to pack in about 2 hours worth of work in an
That's
hour.
no
So
problem.
you did a great job.
It's true.
I'm gonna kick it over to quickly go through slides number 11 through 19 in like 3 minutes. Go.
Got it, John. Morning, everybody. We're putting a lot on the slides in case we have to rush through, because we are honoring that this is a 1-hour call. We just wanted, this is time sensitive. If people did not file tax returns in 18 or 19 and they have children, they're on SSI or VA benefits, they need to register by May 5th to get the $500 child reimbursement. Otherwise, they have to wait until next they file their tax 2020 taxes, which would be next year. By then, might be nice to have the money, but it's a little late. The CDC's issued some new guidance on COVID-19 symptoms. You can read that. Thing I want to use my 1 minute for is to talk about hazard pay. I think it's been noted numerous times on these calls how hard everybody's working, and the frontline staff, especially working with our homeless clients in the shelters and the hotels and in permanent housing, that COC funds can be used to pay for hazard pay. This is not a waiver program. This is always regulations. We've uncovered this to share it with you and encourage you, if you have unspent funds in your budget line item for social services, to consider providing hazard pay to your employees. There's some information on this slide about it. In order to do that, you do need to have a set of emergency policies and procedures in place that say, in case of an emergency, you are going to pay hazard pay. And we have created some sample emergency policies that folks can download. There's a link right there. Change the name to your agency and customize it for your needs, and it will enable you to meet both the HUD requirements around the waiver as well as do hazard pay. And if I could say it again, if I personally had the money, I'd give every frontline worker some extra money. And it can be a one-time bonus, or it can be in addition to their hourly rate. I'm sure we'll get some note. There's some more information about expedited grant amendment process. If you're not spending all your money and you need more time, use this expedited process. Even what the first year awards can be amended. So you can amend and extend to the end of the year. Can also use COC funds to pay for phones. They do need, there are some special rules. You can read what we have, and you can also read the HUD FAQ on this. And then finally, we are getting a lot of questions from people about people that we're not always following all this social distancing guidelines. People in your family may not be following the social distancing guidelines or behaving according to our guidance from our public health officials. But here's a tool for you to use, again, a link about changing the norms with people around those problematic behaviors. And it's a tool you can use with your staff to help think about what are the things you're seeing and how do you have a consistent response. So I think I've used up my 3 minutes. I see some box here.
Yeah, we'll send the link. Actually, yeah, we'll send the link out through the chat box before we end, for those of you who want to click on it through that. Just a reminder that we've also sent out an email that has that link embedded, but we'll get it to you a lot of different ways.
I just want to take Alice's question, John, if that's okay. because I think a lot of people, if the state agency is the grantee, should the emergency policy come from them, or can the contracted agency create the policy? You need policies on multiple levels, both as the grantee and the recipient, but then also as an agency to implement that hazard pay. So these are meant to be adopted by whether you're the grantee or a subrecipient or an individual agency.
Great. Other questions? If not, if we could go to slide number 35.
He's got me jumping today.
Yep. So in lieu of that, we're going to do our happy dance. So wherever you are, I want you to do your happy dance, shake it out, do your Snoopy. Okay, good. We got to keep this interesting. The slide after that, again, reminder, we meet at noon next week. We're going to be talking about assessing and responding to domestic violence during the crisis. We know that that's an epidemic, almost more than COVID. So we'll have some experts come and talk to us about that. I know we're just slamming you with more information than you can digest in 1, 2, 3, or 4 settings, but I think the idea is that when you get to a place where you need something, oh, I need to create a policy, you'll go back to these slides, you'll click on the link that you need, and you'll have that information available for you. We're not expecting any of our COVID-19 resource experts. Also, just a reminder, on the next slide are the emails for all of the folks who work at Housing Innovations that are connected with us. And really feel free to reach out to any of them individually. If something Suzanne has said or Lauren has said in the past, you can go directly to them, or you can go to just our general CTBOS@gmail.com. We really, we're here for you. We're trying to support you the best we can. We hope that these Friday 1-hour meetings are helpful for you. If there are topics you want to see, if there are suggestions for how we run the meeting you want to see, if anyone's got a funny hat that they can send to me, I'm running out of my Halloween cash. I've got a few more, don't worry about it. And if you want to wear a funny hat yourself, feel free to do so. Are there other questions before we allow for Bobby Joe to show us a cute kitty, or anyone else who's got a pet at their feet, if you want to pick that up and show us your beloved animal? Oh, I think Bobby Joe's going to get, oh, there's Alice's, oh, there's Bobby Joe's. Kids, pets, they're all welcome. Spouses walking behind you with a cup of coffee. We're trying to stay as human and social as possible during our time in isolation. So feel free to bring your whole selves to these meetings. Anything else we need to talk about today? Otherwise, Housing Innovations, thank you for coordinating this and putting together the slides and reaching out to presenters. And I think, what are we actually giving people 6 minutes of their lives back? This is my gift to you people, 6 minutes. Don't squander it. We'll see you next week at noon. Bring your lunch. We'll eat together.
Thanks.
Okay. Bye, everybody.
Bye, everyone.